stomach operation, if let's say your stomach is partially removed, will this stomach grow back to normal size? And how long will it take?
Who are you directing this question to? To Dr. Wong is going to take the question? Yes.
Hi, okay. I'll take that question. No, the stomach will not grow back to normal size, but it will expand a little bit over time. And most patients will feel that they can eat much better after about 9 months. And that's usually also after the period of chemotherapy. Yeah, so it will improve in terms of your feeling of fullness and the ability to eat. Yeah.
Thank you. Next question? Yes.
I had my stomach, I think about 80% removed, and like what Dr. Wong mentioned, after 8 months or so, I can eat. I can go to the normal food store and never have to ask them to reduce rice or whatever. It's normal, back to normal. So it's very possible to, with I was told my stomach is just a fist size left, but I actually can eat normally. Of course, I cannot enjoy buffet as much as, but I can sit down to have a 10-course Chinese dinner because it's actually quite slow pace, and so it can be quite normal after that as well.
And Mr. Ang, you have had your stomach all removed?
About 80% or so. Yeah.
80%, yeah. Okay.
So left only a fist size left. Yeah.
Fist size left, okay. Next.
From Wong. Many people say that when you have an alkaline stomach, it's better than having a more acidic stomach, because the acidic stomach will easier to cause cancer, whereas alkaline, where you take a lot of alkaline food, is better than not.
Thank you very much for the question. Okay, the natural environment in the stomach is acidic in nature. Okay, so all of us sitting in this audience who have a stomach, in the distal part or the end part of the stomach, there are special cells that produce acid in the stomach. Okay, when they produce acid, the environment of the stomach all the time is acidic in nature. Sometimes it goes up, sometimes low, depending upon meal time, whatever it is. And as the food goes through the intestine, that acid is neutralized by the alkali that is secreted from the intestines. So at the end, the balance is zero. Okay, so the effect of taking alkali to alkalinize your stomach, to me medically, is not really a sound idea. However, if you have acidity, like people have reflux disease, they have burns, then it can be used to help relieve symptoms. But as a normal part to alkalinize stomach, probably not a great idea.
This has always been a debate and a question.
How useful is barley grass or wheat grass to our normal health?
Sorry, barley grass, did I get the question? And wheat grass, is it? Are you talking about the juice?
Yes,
okay.
Juice.
Okay, so if we are talking about just general juice diet or juice, how juices actually help, the recommendations is always to have the fruit or the vegetables rather than the juice, because when you juice it, you're actually removing the good stuff, which is the fiber, and that is not ideal. Or if, depending on what goes in the juice as well, so if it's like sugar sweetened, and also you're also adding on unnecessary calories, so that's also not recommended.
Thank you. Next question, yes,
yes
gentleman.
Yes, doctor, can I ask you this question? My stomach has been cut for more than 50%, I think. More than 50%. The remaining is 1/3. Since 1989. After that, the first few months, when I discharged from the hospital, the stomach seemed to go back to normal. So after a few years later, recently I went to see a specialist, complained that my stomach is not feeling well and sometimes feeling pain. And what the doctor have done for me, besides that, I have done an endoscopy a couple years ago and a colonoscopy also. So he doesn't want to do an endoscopy. What he does is the ultrasound. So after the ultrasound, he told me it seemed to be normal. So I tell him later, a couple of months later, I said I still find the pain and the discomfort in my stomach. So I asked him, why don't you do endoscopy and a colonoscopy?
What is your question, sir, to the doctor?
My question is why the doctor don't do an endoscopy for my stomach? And then instead of that, he do a ultrasound, and then a CT scan, and then a blood test. But he said these three are all quite normal.
Yeah, I think it's difficult to give you a full answer without having seen you as a patient in the consultation room. But I would hazard to guess that perhaps the way you describe stomach pain and the doctor having examined you and taken the proper history might feel that the pain might be due to some other things, and that's why he has investigated with scans instead of scopes, and given you the answer that the scans are normal. Yeah, but certainly if you have pain or discomfort that is related to the stomach, and that is usually in what we call the epigastrium, the upper part of the abdomen just under the rib cage, then I would agree with you, perhaps endoscopy needs to be performed. If you're not getting the answer from your current doctor, you might want to seek a second opinion. That's always very possible, and see what the other doctor has to say. But perhaps probably it might be just based on your discussion and the examination, and what the outcome of that was, that he decided to investigate in that manner.
Yes. So perhaps you would like to seek second opinion if you're doubtful about that.
Your suggestion that you recommend me to have a second opinion.
I'm saying it's difficult for me to guess based on your description why the other doctor proceeded that way. Only you yourself would know, and of course your doctor who saw you. So it's best to have a discussion with that doctor, and you feel that you are not getting the answer that you wish, or you feel your symptoms are not being addressed by this doctor correctly, it is possible to ask, it's possible to see another doctor for a second opinion.
This doctor has seen him for more than 10 years.
Yeah, and if you trust him, having seen him for more than 10 years, then perhaps you should take his advice. Yeah.
You have to feel comfortable with your doctor regardless. And if you feel what he has provided, we cannot diagnose or give you any prognosis here based on your description. However, if you felt that your doctor is not answering, and everyone is different, perhaps you might want to seek second opinion and have other doctor give you the treatment or a diagnosis. Yes, thank you. Next question, yes. Yes, it's on.
One is the polyps found in the stomach.
Polyps.
Are they serious? Secondly, my brother just passed away from gastric cancer, stage 4, last month. Now another member is diagnosed with ulcer. Would this lead to cancer?
Sorry for your
Stomach
loss.
cancer.
Okay, so the first question on gastric polyps, most of the polyps within the stomach are actually benign in nature. They are not cancerous in nature. There are some which have a predilation that over time, if it continues to progress, it may become cancer. And there are different ways of identifying these polyps, right? Some, when you do an endoscopy, outrightly you can say this will never become cancer because we know from the history. There are others which have a certain look and characteristic and we can recognize and we biopsy them. And if we feel that over time this is likely to become one, they will advise you on a treatment of it. Okay, so much so for the polyp. Now, will an antral ulcer, that's what your question was, sad to hear about your brother. Would that antral ulcer become a cancer? Usually whenever we find an ulcer in the stomach, we would biopsy that ulcer, okay? And the norm of the practice is that once you have a stomach ulcer and it is diagnosed to be benign in nature, we would give the patient medicines to take and recall the patient back for an endoscopy later to again biopsy to make sure that there is no cancer. Okay, because you see an ulcer can be this big, you cannot bite around all the ulcer to get a biopsy, right? So when you treat for a while and that ulcer disappears, if there is any abnormal area, then we tend to go on endoscopy and again do a biopsy to be 100% sure that one, healing has happened, and two, there is no cancer which was missed on the first endoscopy. All right, so ulcers generally, cancerous ulcers will begin as cancerous ulcers. If they are benign, that means they are related to acid disease, Helicobacter pylori or others. They do not tend to become malignant. I hope I answered your question.
Thank you. We have a next question over there. Yes, sir.
My wife had some stomach problem, and then sometime last year she had the endoscopy done. It was found that at the lower part of the stomach there were some polyps, and after investigation by the hospital, say the polyps are not cancerous. So, and the condition did not improve, but the specialist suggested to have the colonoscopy done, but unfortunately that was to be done January this year. But unfortunately, my wife suffered a minor stroke in December last year. So the colonoscopy was not done. But then now she's recovering quite well.
What is your question?
And my question is, she is weak in health. Is it still necessary to have the colonoscopy done to make sure that her stomach is okay? Only the polyps were detected.
Yeah, so like Dr. Asim said, the stomach polyps are by and large benign, and we do not need to do the scope again to look at the polyps in the stomach. But as to whether or not she can have the colonoscopy, whether or not it is still indicated, I think it is best to go back to the same doctor that suggested it in the first place, because then they would be able to reassess her based on her new current state and her current condition, and also whether she still has any symptoms related to the abdomen that might warrant putting her through a colonoscopy.
Is it necessary to remove the polyps if it is not cancerous?
For the polyps in the stomach, it's not necessary to remove them if they have been determined to be benign of a certain kind, and that would have been done in the first during the first endoscopy.
Okay, thank you.
I have another question for Miss Sandy Xiao. Now we all know this organic and non-organic foodstuffs, vegetables and fruits. There was people saying that this organic is more healthy, and then of course the price is much more expensive than the normal pesticide type. So, but then the nutrients are the same. So,
what is your question?
Is not necessary to pay much more for so-called organic foodstuffs, isn't it? Just to buy the ordinary food will be the same.
You have answered your question. You have answered the question. The slides have shown this exactly, but okay, yes. So would you like to add on?
Yeah, actually, like what Ivy mentioned. So, sir, you have answered your question. Actually, that was the conclusion that I had in my slide. That nutritionally there is no difference for organic food versus the non-organic food.
Thank you. Hold on. Over there, we have up there a question.
Hello, my question is, recommendation is 2 servings of fruits and veg per day, but what happens if you take excessively, say maybe 5 or 6 fruits per day? Would that go to a waste? And my second question is, how to find out the early symptom in the stomach cancer? Usually when you discover is at the advanced stage, which my father, he was diagnosed in the advanced stage of cancer, operated in the public hospital, and he did not die on the table, but he died days after the operation. Thank you.
Okay, so I'll address the having 5 or 6 serves of fruit a day. So I think the recommendation is that for adequate fiber intake, okay, and we need to look at the plate, which says that half of your plate should generally be made up of that. Okay, but that being said, if having 5 or 6 serves, we have to look at whether it's replacing your other food, okay, which is the whole grains or your meat, okay, or even your vegetables, because that is not to replace your vegetable intakes if you're not having any. Okay, so that is one thing to consider, whether you're replacing that with the rest, replacing the rest for this, because then that may lead to some nutritional imbalances as well. Another thing for excessive fruit, if you're not doing so, is just on top of everything else that you're eating. What to consider for is that though fruit is a healthy snack, but it still comes with some calories. So if you are getting excessively on top of everything and you are not within the healthy weight, or that is also a potential extra calories for weight gain. So we will recommend excessive intake for fruit as well.
Now, the question which is related to the fact of diagnosing cancer early and symptoms of cancer, gastric cancer early. Unfortunately, this is one of the biggest bugbears of this cancer. Most patients do not have any specific warning symptoms, and symptoms do not necessarily correlate with advanced or early disease. That means a patient can come with bleeding, it can be early disease, can be very late disease. Patients may be perfectly well for so long, and the first effect could be just tarry stools like stand here. Yeah, so that's relatively unfortunate, but what we're trying to advocate is if patients do have symptoms, then please, if they are not going away, seek help. Don't wait, okay? We cannot control the spread of disease, we cannot control how aggressive the disease is, but at least if we can diagnose, rather than patients waiting out there for 7, 8 months, 12 months before they come, we can start finding out reasons and trying to help them earlier.
Yeah, you know your body the best. We have a last question over here.
Hello. No, will high acidity stomach leads to gastric cancer?
No, not exactly, right? High acidity does not lead. Generally, the body regulates the environment that we have within the stomach very nicely. unless there is a disease process that is going on, which increases the acidity, and a high acidity will result in production of ulcers, which are also not cancerous ulcers, they are benign ulcers, okay? So high acidity, no, does not necessarily mean it's going to result in a cancer.
Dr. Wong?
I would just like to add on, I think there might be some misconception by the public that acid in the stomach is not good, and that we need to take alkali, water, or whatever to reduce the acidity. I think the acid has been, well, we've been made to have acid in the stomach, and the stomach is been created in such a way that it tolerates this acid environment in a normal state, in a normal person, which is basically the majority of people in this auditorium or in the public. So actually, there's a reason for the acidity. It's not for no reason. And one of, I mean, there are many reasons, but one of the reasons is it's actually antibacterial. The food that you eat, it gets rid of the majority of the bacteria in the food that you eat, the acidity. People who have low acidity in the stomach, perhaps because we give medication to reduce the acidity, they have increased risk of intestinal infections. All right. There's also the fact that the acidity helps in some of the enzymatic processes that work in your digestive system, and so without the acidity, those systems also are affected. So there's no real need in, if you are actually living your life quite happily, to do anything with this acidity. Certainly, if you have some gastric conditions that require medication to treat and reduce the acidity, then that's necessary. But it's not something that I would think after the condition has been treated, you can allow your stomach to go back to its original acidity. There's no need to keep taking medications or food products to reduce acidity.
Before the Q&A, I promised you 2 presents. I will disclose it shortly. But ladies and gentlemen, did you learn new information? Are you more aware of gastric cancer from today's program? Yes? Please give all our speakers a big hand. Dr. Sylvia, Dr. Wong, Ms. Sandy Xiao, and Mr. Ang.